Welcome to our deep dive into one of the grimmest statistics in America today. In this video, unveiling the top U.S. states with the highest mortality rates, we're going to explore the regional health disparities that exist within the United States. We'll be spotlighting states where mortality rates are alarmingly high, delving further into some of the common causes, and examining the ways that these issues could be mitigated. Join us as we attempt to grasp this sobering dilemma in hopes of sparking discussions and actions towards health equality in all states. 1. Death rate by state. 2024 Understanding mortality rates involves more than just numbers. Simply put, the death rate is often expressed as the number of deaths per 100,000 individuals annually. For instance, if a city reports a death rate of 500 out of a population of 200,000, this suggests approximately 1,000 annual deaths, pointing to broader health issues. As we venture through 2024, examining these figures helps us understand the prevalent health challenges and the measures required to address them effectively. 2. How is the death rate calculated? The calculation of death rates stands as a straightforward yet powerful public health tool. It is derived by dividing the number of recorded deaths by the total population, multiplied by a fixed denominator, often 100,000, to standardize the data across regions. This statistical methodology is crucial as it accounts for population size variations, enabling more meaningful comparisons. For example, a state with a high elderly population might naturally exhibit higher death rates due to age-related factors, necessitating careful interpretation of these data. 3. West Virginia. The pinnacle of mortality. West Virginia holds the grim title of having the highest mortality rate in the United States. With a stark 1,655 deaths per 100,000 people, the state highlights significant health and lifestyle challenges. Factors contributing to this include limited access to healthcare services, high rates of obesity, smoking, and substance abuse. These elements collectively strain both the healthcare system and the community, underscoring the urgent need for comprehensive public health interventions. 4. Chronic conditions plaguing Mississippi. With a mortality rate of 1,393 per 100,000, Mississippi exemplifies the intersection of chronic health issues and socioeconomic challenges. The state faces an amalgam of high diabetes, hypertension, and heart disease rates. The prevalence of poverty exacerbates these conditions, as many residents have limited access to nutritious food and healthcare resources. Improving public health awareness and accessibility can play pivotal roles in reversing these trends. 5. Alabama. In the crosshairs of health disparities, Alabama reports a death rate of 1,367 per 100,000, illustrating the persistent health disparities within its borders. Similar to its southern counterparts, Alabama grapples with significant cardiovascular and respiratory health issues. The state's efforts must focus on improving healthcare infrastructure and promoting healthier lifestyle choices. Collaborative endeavors between policymakers and community leaders are imperative to drive meaningful change. 6. Kentucky and the battle against substance abuse. Kentucky's mortality rate, hovering at 1,337 per 100,000, reflects its long-standing struggles with substance abuse, particularly opioids. This crisis strains the healthcare system and devastates communities. While initiatives to curb drug abuse are underway, enhancing access to rehabilitation and mental health services remains critical. Education and rehabilitation could offer a lifeline to those trapped in the vicious cycle of addiction. 7. Arkansas. A call for health equality. With a mortality rate of 1,324 per 100,000, Arkansas contends with issues similar to its regional peers, ranging from obesity to tobacco use. Disparities in healthcare access and education further compound these challenges. Emphasizing preventive care and health education might alleviate some of the burdens, fostering a healthier and more informed populace. 8. Exploring solutions. How can states lower their death rates? Addressing high mortality rates requires multifaceted strategies. States can focus on ensuring adequate healthcare accessibility and emphasizing preventive measures within at-risk populations. Early health education, lifestyle modification support, and healthcare affordability are critical aspects of any sustainable health initiative. Moreover, robust public health policies can pave the way for healthier communities and reduced mortality rates. 9. The COVID-19 impact. A looming shadow. The ripple effects of the COVID-19 pandemic inevitably influenced mortality rates in 2020 and beyond. The aftermath of such global phenomena can contribute to increased death rates due to the added medical burden and delayed treatment for non-COVID ailments. Scrutinizing these impacts over the coming years is essential to paint an accurate picture of the pandemic's lingering effects. Understanding and confronting the factors contributing to higher mortality rates is undeniably complex yet crucial. Through informed discussions and strategic interventions, the potential for making meaningful health improvements remains within reach. Source: